Today on When Opinions Collide, we'll be talking about vaccines, to vax or not to vax. We have two very, very wonderful individuals with us today, and I'm excited to hear from them. And it's not your typical conversation. Normally, you have folks who say that we should force vaccinate everyone and anyone. And then we have the folks who have no answers to the questions that are brought to them about these older diseases, these things that vaccines were designed to protect us from. Today, I think I've got some guests that will have a lot of fun. I'm your host, Jonathan Fiala. This is When Opinions Collide. Howdy. So, today I'm joined by Dr. Bethany Rife and Robin. How are you guys today?
We're good. Okay. Hi.
So, I'd like to go ahead and start off with this is a really interesting issue, and it's one of those issues that you see folks sort of demonize the other side. And I'm really, really interested to hear what these two have to say today because they have some thoughts, and actually, I think we can find some common ground, at least in thought process. With that said, I'd like to go ahead and start off with giving Robin the floor. She's a biologist who's worked with the Human Genome Project in UT Dallas. I'll give her the floor and let her speak for herself here. Go ahead and tell us a little bit about yourself and what your opinions are and your journey.
Thanks, John. So I started off as a normal mom. When I was in college, I majored in biology with a focus in human genetics, and then I went on to work at the Human Genome Project at UT Southwestern at Dallas. And it was a few years later that I decided to go to law school. And so I ended up having a legal career. And when I became a mom, with my firstborn son, he came into the world, and within a day or two, we vaccinated him for hepatitis B, as you are asked to do at the hospital. I had not researched hepatitis B. People are surprised to find out you don't study infectious disease necessarily in getting a degree in biology. It wasn't a course that I took. I didn't know that it was a blood-derived or blood-borne illness. And I did not know that it was typically spread through the use of intravenous drug needles and risky sexual practices. Had I known that, I probably wouldn't have vaccinated him for that. So he got that vaccine before we left the hospital. And then at 2 months, we went ahead and we vaccinated him with 7 or 8 vaccines and several combinations. And so polio, rotavirus, pneumococcal, another hepatitis B, pertussis, diphtheria, tetanus. So he got them all at 2 months old. And he by then was a colicky baby. And so as we were driving away, he fell into a really deep sleep. And I was not used to having a kid who slept in public. He didn't hardly sleep during daytime at all. And he was so tired and in such a deep sleep that I actually pulled over in a parking lot and I called my husband and I said, something's wrong. I'm looking at him and he's just sound asleep in the car. When I got home, I lifted him out of the car seat. He was sound asleep. I put him into his crib. He was sound asleep. This lasted for hours. And when he woke with this high-pitched, shrill scream. It was an absolute nightmare. So many moms have gone through what I've gone through. They've heard what I've heard. Their little arms jut straight out. And these are tiny, 9-week-old, 10-pound babies. And he's screaming this high-pitched scream. And I'm calling the doctor's office. They're lying to me. They're saying that it's normal. They're saying that it's pain from the injection site. It very clearly is not the kind of scream a baby would have if he had a sore thigh. That's just simply not what it was. This was a full body pain. And I'm trying to nurse him through it. The doctor's telling me to give them some of the baby Tylenol that they sent me home with, which come to find out is probably one of the worst things that you could do. And he cycled through this several times in that day. And it seemed by 6 or 7 p.m., he seemed like he was going to be okay. And people say, why didn't you go to the hospital? Well, I mean, I had just had a baby. I was postpartum. Postpartum anxiety stops you from making the kind of decisions that you would make 10 years later. And I had a doctor on the phone telling me that it was no big deal. So he seemed to be okay by the evening. And then in the following weeks, we started to watch his head grow. He had a little knitted cap with bear ears on it that was so cute. And just within weeks, it didn't fit him at all anymore. His head had really started to grow. And he went from the 50th percentile to the 60th, to the 70th, to the 80th, all the way up to the 90th percentile. Within a few weeks, this kid's head was enormous, and the pediatrician was not concerned. He said as long as it was still on the chart, then that's fine. But I mean, there's a line of thinking that says if your child's growth rates aren't staying on the same line that they had already been on, that it is a cause for concern. His weight and his height wasn't changing like that. Why was his head growing to be so enormous? You see a lot of these kids now, and it's actually a hallmark of autism, is to have a certain head shape with like a certain sort of spacing now between the eyes and this proportion of forehead. And you have to wonder if these children's brains are swelling. Of course, no one is really doing any research into it. He developed eczema, and people think that eczema is no big deal. Eczema it has the potential to be an absolute nightmare. It's dry, cracked, weeping, sometimes bleeding skin inside the elbows, backs and knees, on the wrists, on the ankles. When he started eating, he started reacting to everything that he ate, banana, sweet potato. So his cheeks were inflamed all the time. And you see babies like that, whose cheeks are just inflamed all the time. Mucus coming down, and the mucus is causing rashes. It was just a nightmare. Just he ate one bite of banana. He had a rash for 10 days. And at 6 months, I took him in. And so I asked the pediatrician what's going on. And the doctor went ahead and tested him, just like a general, probably top 12 allergen panel, came back and said that he had a peanut allergy. So we're very lucky. By the grace of God, we knew that he had an anaphylactic peanut allergy from the age of 6 months old. So we had to learn to live around that and to be very protective of him. And he has, despite my best efforts, and it's always my fault, gone into anaphylactic shock 5 times between the ages of I think about 3 to 7, he went into anaphylactic shock 5 times. I mean, I've got a kid who looks at me and says, "Mommy, I'm dying." It's horrifying. And I mean, and it's truly horrifying, because if you mess up, as I have messed up, and you delay administering epinephrine, as I have delayed, your kid can absolutely have a stroke, have a heart attack, go into anaphylactic shock where his blood pressure drops. Like, all of these things have happened to us. He's gotten peanut protein on his little fingers in preschool, in a peanut-free school, because somebody brought it in. It got on the dinosaurs, and he rubbed his eyes. And I mean, and my kid is dying right in front of people, and they don't know what's happening. He just slows his breathing. He stops talking. He's not standing anymore. They don't know what's happening. And he's this little tiny guy. He's 4 years old. And I'm like, EpiPen him, I'm on the way. And the ambulance is on the way. And it's an absolute nightmare. This little kid turned me into who I am today. And so I really went on a quest to learn about vaccination, anaphylactic food allergies, and especially aluminum, which is something I hope that we get to talk about today, and how it's this elephant in the room with vaccination that nobody is talking about at the doctor's office.
Wow. That's a lot to go through, especially as a mom. I can't even imagine. And thank you for coming on to share today. Bethany, you have the floor. Tell us a little bit about yourself and your position.
Hi, my name is Dr. Bethany Rife. I'm a pediatrician. I've been a pediatrician for about 10 years. I just in the past few months I worked at a regular pediatric clinic, just a small practice, 6 physicians, so not related to any giant hospital system or anything. But just in January, I left that practice, opened up my own cash practice. I got tired of the insurance, just not being able to take care of my patients well, because I'm expected to see them in 7 to 15 minutes. And that drove me nuts. The other thing that also contributed to me founding my own practice is this whole vaccine issue, because I think that patients should have a choice and parents should have a choice. And so I'm not your traditional physician that says everyone has to be vaccinated and, why are we giving parents choices and those kinds of things. That's not who I am. I have several unvaccinated and partially vaccinated patients in my practice, and several fully vaccinated patients. So that's how I prefer to practice medicine. I think everyone should, this should be something that the parents and the physician discuss. Both parents should be involved in this discussion, and hopefully on the same page. And I'm just here. My role is to give you as much information as I can, educate you the best way that I can, answer any questions you have. I tell parents all the time, if you found an article or something you're concerned about, or you have a question, send it to me. Let me go over it. Let me see, help you through the medical jargon, and help you understand, especially if they don't have any kind of a science background. Then a lot of it doesn't make a whole lot of sense. So just trying to help parents, weed through the information, which is hard even for me to weed through all the information when trying to prepare for this. So I very much am for parent choice, but I do think that for most people, vaccines are perfectly safe, and that they do save lives on a regular basis. And these diseases that we're vaccinating for, most of them, there are caveats to that, but most of them are very dangerous, and we're causing hundreds of deaths per year. And so the discussion, I do think, needs to be changed as far as how it's being had across the medical field, and that we don't need to be coercing patients into vaccination. I think that the physician world needs to be open to discussing side effects and those types of things, but also we need to be looking at the data and discussing benefit versus cost, and letting parents make that decision and giving them good information to make that decision. So that's who I am. And I have just a little bit more about me personally. I went to school in Texas. I graduated from Texas A&M. I did my medical school at UTMB in Galveston, and did residency at Texas A&M in Temple, which is with Scott and White. And I have 4 children, and currently living in Alabama.
Well, thank you. Thank you both for being on here. And it's one of the reasons I was so excited to actually get both of you to the table here. It's not a conversation that you normally have. Most people are either no vaccines, no thought, no science. I've talked to people who I've got my crystal, that'll save you from from the things that the vaccines are supposed to save you from. And then I've had doctors say, if your kid is not vaccinated, they have no place in the public square. They have no place being around other people. Basically, the parents are accused of child abuse if they don't vaccinate their kid. And I feel like if it's not in bad faith, maybe that it's misguided statement at the very least to say that parents are abusing the child. They have legitimate concerns that need to be answered. So with the opening statements done, I'd like to ask you, I'll start off with Ms. Robin here. Let me ask you real quick. The danger of anti-vax hotspots is something that a lot of people talk about. And I hear, we had that breakout in New York. People talk about Austin as a huge problem because we have X amount of children there who are not vaccinated. What would be your response to people who say that anti-vax hotspots are actually a danger to those who are immunocompromised, or just a danger in general?
I would like them to point to any incidents in the past that has ever happened. I mean, to my knowledge, there has never been an incident of an unvaccinated child or an anti-vax hotspot that had a measles outbreak and then exposed measles to an immunocompromised child who then died of measles. I actually think that's some sort of urban legend. And I talk to enough lawmakers that I do know that this is passed around all the time, and it's testified to. Public health testifies to this sort of scenario about these are the kids that we have to protect, the kids on chemo, organ transplant recipients, which there aren't even very many of those in the whole country. I've never known it to happen. And I'll tell you, if something like that had happened, it would be national news. All of us would know, like, oh yeah, what about this incident? What about this incident? So we don't know about it. I don't know about it ever happening. It's funny you mentioned Austin. I'm actually from the neighborhood that is right in front of the Waldorf school that is probably Austin's #1 anti-vax hotspot. I mean, that's exactly where I grew up, and that's a very small school. I know people who go there. And so, I mean, I don't know what the enrollment is, but you can get a very high percentage-wise anti-vax hotspot if you only have a few children enrolled in the school, you know, so if you've got 10 unvaccinated kids or 20 unvaccinated kids, but you've got 200 enrolled in the school, that's not very many unvaccinated children. But when you call it an anti-vax hotspot, and you might see the headlines, 20%, 30%, 50%, something like that. I mean, what if you have a school of 10 kids and 5 of them are unvaccinated? That becomes an anti-vax hotspot. That's reported in the news percentage-wise, but you don't know what the total enrollment is. So it's very misleading, but I've just never heard of an anti-vax hotspot being an issue. I think that the truth behind anti-vax hotspots is that ordinarily they are ethnic and religious groups who are intentionally exposing their children to something like measles. And so you can have Ukrainians, you can have Orthodox Jews, and they are not afraid of these diseases at all. And I'm not saying all Orthodox Jews don't vaccinate. I'm sure there's a ton of Orthodox Jews who do vaccinate, but there's a large proportion that choose to expose their children to measles. They take care of their children through measles, and then they have lifelong immunity. No one's going to end up getting measles at 45 years old when the complications are far more serious and end up in the hospital with encephalitis, when they could simply have it when they're 9 or 10 years old. And so we're looking at these communities in, let's say, New York State or in Washington State with Ukrainian immigrants, and we're acting like the whole thing is this out of control accident. It's not an out of control accident. The Washington State didn't even have any incidents, I don't believe, of anyone outside of their own community coming down with measles. So it was actually a very controlled and intentional outbreak.
So actually that rolls right into my first question for Bethany Rife. Bethany, what are these diseases that we're vaccinating from? I mean, weren't a lot of these childhood diseases that people got over when they were young?
Some of them, like measles and chickenpox, for the most part, especially chickenpox, yeah, most people get chickenpox. They do just fine, but there are percentage that get severe chickenpox and get an encephalitis and die. Measles is a higher percentage of that, and so that's why the measles is vaccinated for, maybe was developed sooner than the chickenpox. But the big ones, I mean, measles is somewhat of a big one. The reason I think measles is considered such a danger is just because it spreads so easily. If you are not vaccinated for measles and you're in a room near, even after the person with measles left, maybe 2 hours ago, and you're in that room, your chances of catching measles with exposure is 90%. So it spreads so fast, so easily. The way we rate diseases is how many, if one infected person, how many people would get it from that one infected person, assuming a completely non-immune population. One person will spread measles to about 16 people. So that's really fast. And so then that spreading, really mentioning like who we're protecting. Yes, we're protecting the immunocompromised, but that includes every child less than 1 year old. We're protecting the babies. That's who we're protecting. Those are who get the measles and chickenpox. You get them less than 1 year old, your chances of getting really sick are really big. And that's what's concerning. But aside from those diseases, the ones to me that are scarier is the Strep Pneumo, which is the Prevnar vaccine. Strep Pneumo can cause basic things like ear infections and UTIs, upper respiratory infections. It also causes pneumonia, meningitis, sepsis, and death. And I think that one's probably the one I talk about the most, because I've seen 2 children die of strep pneumo meningitis back in residency. I wasn't paying attention at the time to the vaccination rate, so I don't know if those children were vaccinated or not. They were both over 1 year old, though. They were somewhere between 16 and 18 months. And everything was done properly. It's not like they were brought to the hospital late or anything like that. They were brought in when they had fever. It wasn't recognized immediately. We just knew they were sick. They were started on antibiotics. And basically overnight, they deteriorated and were gone by the next day. And we were doing everything we possibly could that we knew to do. Nothing was missed or done wrong. They were given appropriate medical treatment. There was a baby just a few months back in my previous practice that had also got strep pneumo meningitis, and she actually had her first vaccine, but one vaccine in a baby is not considered incredibly protective. It's only partially protective. and she survives. We think maybe she's deaf, but she is alive. And then there's also Hib, Haemophilus influenza, which is a bacteria. It's not related to flu. Same idea. It causes the meningitis, can cause death. When we came out with that vaccine, doctors in the hospital say that their meningitis rates went down by over 50%. So we're saving lives.
So thank you for that.
I just jotted down some notes. So if you don't mind, can I respond specifically to some of Bethany's points?
You know what? Jump right in.
Okay, so I want to go to, so Bethany, you pointed out that one person infected with measles can give it to 16 other. I happened to read a really interesting article last year, and I actually just went and found it this morning. And it talks about that. I think that the actual number that they're using is so that RO number, which is the basic reproduction number, the number that it's assumed an affected person can spread to, it's 12. But in densities, then it can be higher. I think, but like nationally or on average, it's assumed to be 12. But that gets into the very interesting problem with the measles vaccine, because in densities and in high contact communities, such as Orthodox Jewish communities, that number can be as high as 24. It can be as high as 36. So there was this really interesting article, and Bethany, if you want, I can find it for you and send it to you. It came out May 2019. New York Daily News, and it was this infectious disease doctor named Dr. Daniel Berman. And so he's Jewish. And so he was, first off, wanted people to know, yes, Jewish people vaccinate their kids. However, you have a primary failure rate for the measles vaccine, which means the number of people who are non-responders, right? So the primary failure rate of the measles vaccine is 7%, right? So if we're going to claim that you need 95% vaccinated to have measles vaccine herd immunity, we're already failing right out of the gate, even if 100% of people were vaccinated, because 7% don't respond. So then we do the second dose. And with the second dose, you do pick up a couple percentage points with those non-responders, but that's not lasting immunity. It could last a few months, but the people who are non-responders tend to go back down to baseline rather quickly. And so in an Orthodox Jewish community, basically, if we say you have 93 or 94, 95% efficacy for 2 doses of measles vaccine, if it's high contact, they had this mathematician explaining that even a 100% vaccination rate in a high density city or high contact community still would never meet herd immunity. Never. Like, there's nothing we can do unless everybody spreads out and goes to live on a farm. So that's just something really interesting. And that's not anybody's fault. That's just the primary failure rate of the measles vaccine. On top of that, we have secondary failure for measles vaccine. So what that means is in 10, 13, maybe 15 years, you've got 10 or 15% of the population whose antibody threshold has dropped below what is deemed to be the protective rate. And so, like, that's another percentage. On top of the 7% who are non-responders, now you've got the people that the vaccine has waned in. So it's really not solely an issue of parents who are refusing to get the MMR vaccine, whether for personal or religious reasons. The vaccine can never replace the natural immunity. And I agree with you about how serious this is for babies. We have to look at the history of measles, though. Measles was never a disease of babies. The measles infection wasn't even a disease of older people. Prior to the vaccine being licensed, which I think was 1962, the average age of infection was 10. And that's the perfect age for a healthy kid to get a measles infection. So those babies, just by virtue of being gestated and then of being hopefully breastfed, they have a couple of years of immunity from their mothers. And then actually they've got true herd immunity, because herd immunity with measles vaccine doesn't mean that measles is going to go away. Herd immunity with measles, I'm sorry, I didn't mean measles vaccine. Herd immunity with measles, natural measles, never meant that measles was going to be eradicated. It meant that it came in 3 to 4 year cycles. And so historically, and actually we still see this today, even with the measles vaccine, outbreaks happen in 3 to 4 year cycles. And so you have these kids who, they might be around measles, be around it, they don't get it, and then all of a sudden everybody gets the measles. And so that's just cyclical, that's just natural for how it is. And now we have vaccinated these kids, so 1-year-olds have immunity from the vaccine itself, and then it's going to wear off. And so when you have a baby who's not vaccinated for it, born to a mother who was vaccinated for it, and she doesn't have any natural immunity to pass on, that baby is now in a danger zone. That's a man-made problem. We did this. Public health did this. Public health failed us. on this issue. I know that you're probably wanting to move on, but can you
I
ask
just
me
want to
quite
jump in and let Bethany actually go ahead and respond to that. You took, or we took about 5 or 6 minutes there. Bethany, you've got the floor for 5 or 6.
Okay, so we would have to know, and I don't know off the top of my head, the rate of measles infections in the past and the rate of measles deaths in the past. But if you think about it, back then when we had people unvaccinated and spreading the disease, like what you're saying about it was mostly a disease of childhood, if not of babies. Back then, babies stayed at home with their mamas for who knows how long, for the first 6 months to a year. Mamas weren't working like they are now. These kids weren't going to daycare. My main concern with using that data as of now is that the babies have so much more exposure. The older kids are all going to school. Back in the 1900s, early 1900s, the kids didn't go to school. They had just started to go to these small groups of schools. And so the exposure was incredibly limited. Now, the average kid is probably exposed to, I don't know, a ton, there's just a lot more exposure. So we have to be careful using past experiences and past numbers and information and relating it to now. So that's my first concern. The other thing is I get what you're saying about the herd immunity. Like the vaccine doesn't, we only get partial immunity and partial rates, 90 to 95%. And it does eventually wear off, but we're still decreasing. And that's the goal. I mean, if we can decrease the rates of spreading measles or any of these diseases by anywhere from 80 to 90%, we're saving lives. These were killing hundreds of thousands of children in a year. And it's just, if we can decrease, even if we decrease the spread, and I don't have numbers off the top of my head for that, but if we can decrease, we only had, I think the outbreak of 2018, we had 800 cases or something like that. That's so low compared to what there was before we had the vaccine. So we're still saving lives with that, even if it's not perfect. Like you're saying, it's not perfect at all. Nothing in medicine is.
So with that said, let's catch this right on the other side of the break. We're coming right up on the commercial break. We'll catch you two on the other side.